Okay, can somebody confirm you can hear me?
I can hear you.
Thank you. Before we begin, are there any questions? All right, there's no questions. Let's begin. Let me share my screen here. No, that's not it. We got too many Zoom things here open. Just a minute here. Here we go. My computer is going to be a little slow because it's still working on the lecture file. Let's see where we are on that. 67% done, so we have a ways to go. All right, today is June 31st. Come on. And we're supposed to be working on Lab 6, disc diffusion, and antibiotics. Are there any questions about the unknown project? All right, let's go on to Lab 6.
I had a question. I'm so sorry.
Uh-huh.
For the unknown project, you said you'd email us the results of the first three tests on Tuesday, right?
Yes.
Okay, thank you.
All right. That's the worksheet. I don't want the worksheet yet. Let's find the disc diffusion. There we go. Lab 6, disc diffusion, evaluation of disinfectants and antiseptics, and antibiotic effectiveness. There is some reading to do for this lab, so read about the terminology on page 177, the principles of effective disinfection, evaluating a disinfectant, and the types, page 187 to 194. Read about the chemical methods of microbial control, that's just a page 196. Read about antibacterial drugs, antibiotics, page 554 to 550, and then take a look at table 20.3, and then read about the test to guide chemotherapy, the disc diffusion method, page 567 to 569. And when I'm talking about disc diffusion method, which is called the diffusion method here, and sometimes called the Kirby-Beyer method, I mean always the same procedure. Any question about any of that? This is a method that has been developed to test the effectiveness of an antibiotic against a given bacterial species. There are some video clips in today's lab as well as a virtual lab. Upon successful completion of this lab, you should be able to, 1, identify the type of chemical agent and the active ingredient used in various disinfectants and or antiseptics. 2, evaluate the effectiveness of disinfectants and or antiseptics using the disc diffusion method, that's also known as the Kirby-Beyer method. 3, determine the mode of action of various antibiotics. 4, evaluate the effectiveness of various antibiotics using the disc diffusion method. 5, be able to list the variables that influence the antibiotic disc diffusion susceptibility test. And 6, be able to define the terms. What's sterilization, disinfection, what's a disinfectant, what's an antiseptic, what's a bactericidal agent, what's a bacteriostatic agent, what is an antibiotic, what is a spread plate, and what is a zone of inhibition. For zone of inhibition, I will usually write just ZOI, but when I write ZOI, I mean zone of inhibition. Any question about any of that? All right. Oh, good. The lecture file just finished, so my computer will speed up. Sterilization refers to eliminating all viable organisms, including endospores. Disinfection refers to the destruction of vegetative cells, but not necessarily the destruction of endospores. Disinfectants are a chemical agent applied to an inanimate object. An antiseptic is a chemical agent applied to living tissue. For example, if I were to use bleach to clean my toilet, I would be using a disinfectant. Bleach would be a disinfectant. But on the other hand, if I had a cat, I don't, and the cat were to come home all bloody and I didn't have any antiseptic and I used bleach to clean the cat's wound, I would be using bleach as an antiseptic. Any questions about any of that? Now, usually disinfectants are stronger agents and they can be, I don't know, harsh on the skin. So we don't usually apply disinfectants to the skin. Like usually we don't apply bleach to the skin because it's fairly hard on skin. But
Doesn't bleach kill living tissue?
It would depend on what the concentration of bleach were and how long you applied it, but usually the skin would survive the bleach. It would not totally remove the skin from the area you bleach.
But like if it was not like on skin, but like on like your sinuses or like in your lung, that would kill the tissue and
That would kill the cells the bleach got exposed to, yes. Okay. All right. For example, bleach is used on toilets as a disinfectant, and it used to be used, it may still be used, I don't know, to treat necrotizing fasciitis. They would wrap someone who had necrotizing fasciitis, that's flesh-eating bacteria, in gauze, treated in bleach. I don't know if they still use that, but it's something they used, at least in the past, to treat necrotizing fasciitis. Any question about that? And when bleach is used on skin, it is an antiseptic. Any question about any of that?
I had a question. I'm so sorry.
Uh-huh.
So I'm an endodontic assistant, and we people probably don't know this, but you use bleach when doing a root canal to get rid of the necrotic tissue inside the tooth. When you're using it to like get rid of necrotic tissue inside a tooth, would that be an antiseptic then?
Yeah, it would be an antiseptic, not a disinfectant.
Okay, thank you.
All right. I didn't know that when you had a, what was that called? The
So if you ever have to get a root canal or you've
root
had a
canal,
root
that was it.
canal,
Yeah.
they
Yeah,
use
they use
bleach
bleach,
to
yeah.
remove the tissue inside your tooth. So one thing we're trained on is if bleach, so your tooth number 2 and 3 on the top and 14 and 15 on the top connect to your sinus. If somehow you perforate the sinus and get it in the sinus, it'll kill the sinus tissue and you have a bleach emergency. So we're
Uh-huh.
trained on how to act in a bleach emergency so we don't destroy someone's sinus.
Okay. I know why you're using bleach because it's so effective, but why aren't you using hydrogen peroxide to treat a root canal rather than bleach?
There's a bunch of studies on it if you go to PubMed. And so what you'll use the different types of the doctors have always called them disinfectants. That's why I've asked, but I guess they are antiseptics. But we use EDTA, we call it hypo. We never refer to it as bleach in front of patients,
Oh,
but
that's good.
we use EDTA, bleach, and chloroform. We also never call it chloroform in front of patients. But that's what we'll use to remove any tissue or old root canal filling material from the canal space inside your teeth.
Okay. I'm not sure why you use EDTA, but I will accept your
In
terminology.
case there's calcium buildup, so when your tooth goes necrotic, it'll try to calcify the space closed, and so it'll help remove that calcium buildup so you
Oh,
can get through to the full canal.
I see. All right. Let's go on. To evaluate the effectiveness of chemical agents, the surface of a nutrient agar plate is inoculated with one particular bacterium. And we get the bacteria to grow everywhere, so we call that a lawn of bacteria. Paper discs saturated with different chemical agents are then applied to the surface of the agar. The chemical agent can diffuse into the agar, establishing a concentration gradient around the disc. After overnight incubation, the bacterial growth pattern around the disc is observed. If a zone of inhibition appears, meaning there's an area with no bacterial growth, the chemical agent is assumed to be at least somewhat effective against that particular bacterium. Conversely, if there's no zone of inhibition, the chemical is assumed to be ineffective. Now, this is effectiveness of the agent. This is not the sensitivity or resistance of the bacteria to the agent. Here we have different agents that can be used, alcohols, generally used as an antiseptic, but realize that alcohol is a very weak antiseptic, so we usually call them a degerming agent, meaning when you degerm your skin with an alcohol swab and then inject the needle, you do not remove all of the bacteria from your skin. You reduce the numbers to safe numbers to do the injection, but you do not, sterilize the skin. You just remove most of the bacteria, but not all of the bacteria. Formaldehydes are a disinfectant, and they're a good one. They kill endospores. Halogen, like iodine and chlorine bleach, iodine is usually used as an antiseptic, chlorine bleach as a disinfectant. Heavy metals, their use was discontinued in mainly the medical profession for many years, but their use has come back because of the resistance of bacteria to antibiotics. And so heavy metals are sometimes used like in gauze to prevent bacteria from growing on the wound that the gauze is protecting. So heavy metals are sometimes used as an antiseptic. Peroxygen, like hydrogen peroxide, is a very good antiseptic, and this is one that can kill endospores. So aldehydes and peroxygens can kill endospores. That should be labeled there. It's not there. Phenolics were the first antiseptics that Joseph Lester used. He used phenol. Phenolics can also be used as a disinfectant. And then surface active agents like quaternary ammonium compounds are used as a very good disinfectant. The zone of inhibition size depends only partially upon the sensitivity of the organism to the disinfectant or the antiseptic. Various other factors affect this zone size, including the concentration of the chemical. Generally, the higher the concentration of the chemical, the larger the zone of inhibition around the disc. The molecular weight of the agent can also affect the zone of inhibition size. Generally, the smaller the chemical, the larger the zone of inhibition. And that's because the smaller the molecule is, the greater it can diffuse through the agar. And then the density of the bacteria inoculum can also affect the size of the zone of inhibition. The greater the density of the bacteria, the smaller the zone of inhibition. And there are a few other agents that affect the zone of inhibition. We'll talk about some of those. Evaluation of antibiotic effectiveness. Antibiotics are categorized as bactericidal if they kill the bacteria, or bacteriostatic if they inhibit the growth of bacteria. If a bacteriostatic antibiotic is used, we're waiting or depending on the immune system to assist in eliminating the infection, because once you stop the bacteriostatic antibiotic, the bacteria which were inhibited can now grow. So if we use a bacteriostatic antibiotic, we're relying on the immune system to eliminate the infection. Any question about any of that? All right. The Kirby-Bayer disk diffusion method, which is sometimes called the disk diffusion method or the just the disk diffusion method, is a method that Kirby and Bauer invented to test for antibiotics. And it's a very good antibiotic test system. The results of such testing help physicians choose which antibiotic to use when treating a sick patient. The bacteria are isolated from the patient. They'll be, what's the word? Purified. So you get one bacteria species, and then you put it on an agar plate, so it'll be grown everywhere. And then you put disc on the plate impregnated with different antibiotics, and then you incubate the plate, and then you take the plate out after 18 hours and you look at the zone of inhibition size. Where there's antibiotic concentration high enough, you'll get a zone of inhibition around the bacteria. It may not kill the organism, but it will inhibit the bacteria's growing. So there we have a very large zone of inhibition. Let me blow that up a little bit. A very large zone of inhibition around this antibiotic, a small one around that antibiotic, essentially none around these two, maybe that one too. Okay. Now, the logical thing would be to say that a large zone of inhibition, the bacteria are sensitive, and a small one, the bacteria are resistant. However, the size of the zone is dependent on several factors. The diffusion rate of the antibiotic. The larger the molecular weight of an antibiotic, the less it will diffuse. So this small zone of inhibition may be small just because the antibiotic is very large. And then this large zone of inhibition may be large, not because the bacteria is particularly sensitive to it, but because the antibiotic diffuses very well. Anyways, the sensitivity of the microorganism to the antibiotic will also determine the zone of inhibition. And generally, when the zone is large, you say the antibiotic is sensitive, although we just discussed an exception. And when it's small, the antibiotic is not as sensitive. The growth rate of the bacterium can also affect the zone of inhibition. Let me see if I can remember this. The faster the bacteria grow, generally the greater the zone of inhibition. I think that's right. And the slower the bacteria grow, the smaller the zone of inhibition. So there are several factors that can affect the zone size of inhibition. So when we do the Kirby-Bauer test method, we have to standardize the test method. And here are several standardizations of the Kirby-Bauer test. First, you inoculate the nutrient broth that you grow to inoculate the plate with the bacteria. You take the bacteria from several colonies isolated on a non-selective media and make sure the colonies have grown no more than 24 hours old. And then you grow the nutrient broth for less than 24 hours as well. You adjust the broth turbidity of the media growing the bacteria to 0.5 Macfarlane units. This is approximately 1 × 10⁵ organisms per mil. And we always put this amount on the plate, because if you use a different amount, you will get a different size for the zone of inhibition. We also always inoculate Mueller-Henton agar at room temperature. The Mueller-Henton agar is always pH 7.2 to 7.4. If you use a different agar, or obviously a different temperature, then you'll have a different zone size of inhibition. Let me think if I remember correctly. If you are growing the bacteria at a lower temperature, the bacteria will grow slower. And I believe that will increase the size of the zone of inhibition. If you use a different media, you can also affect the zone size. A different pH can also affect the zone size. I don't know about how the pH affects the zone size. And the Mueller-Hinton auger plates are always 4 millimeters in depth. If it's less than 4 millimeters in depth, then the antibiotic will diffuse through the auger faster and the zone size of inhibition will be greater. If the auger is more than 4 millimeters in depth, then the antibiotic will diffuse through the auger slower and the zone size of inhibition will be smaller. So we always use Mueller-Hinton auger plates at room temperature, pH 7.2, a depth of 4 millimeters, and then we always use a plate of 150 millimeters, which is just the standard Petri dish size. You put the bacteria on the plate using a non-toxic swab, like a cotton swab. You plate the swab everywhere to get confluent growth of the bacteria on the plate. So we have this media at 0.5 McFarland standard units. Take the cotton swab and then swab the plate. Any question about any of that? You then let the plate sit for 5 minutes to absorb the liquid from the swab. Place the disc 24 millimeters apart, no more than 12 paper discs containing 12 different antibiotics on the plate. You always add the antibiotics 5 minutes after putting the bacteria on with the swab, but no longer than 15 minutes after you've added the bacteria to the swab. So between 5 minutes, you to have it at least 5 minutes to absorb the liquid, not more than 15 minutes, because you don't want the bacteria to begin growing before you put the antibiotic down. And then you incubate the plate in a non-CO2 incubator for 16 to 18 hours at 35 degrees C. And then you put the plate in the incubator no longer than 15 minutes after adding the antibiotic disc. Any question about any of that? If you follow this procedure, then wherever you are in the world, you should get the same Kirby-Bayer method, meaning the same zone size of inhibition for the same antibiotic for the same bacteria, regardless of where you are in the world. Any question about any of that? After incubation, the inhibition zone sizes are measured in their diameter using millimeters. The NCCLS, standing for the National Committee for Clinical Laboratory Studies, sets a standard for interpreting the zone size to consider whether bacteria is sensitive, intermediate, or resistant to that particular antibiotic. So here we have a zone of inhibition after we've grown the bacteria on the plate, and that's the paper disc containing the antibiotic. This antibiotic is penicillin. I'm assuming it's penicillin G. The organism plated is Staphylococcus aureus. If the zone size of inhibition is 20 millimeters, if the zone size standard from the NCCLS is 20 millimeters or less, then this species is resistant to that antibiotic. If the zone size is 21 millimeters to 8 millimeters in the size of the zone of inhibition, then the species is considered to be intermediate to this antibiotic. If, on the other hand, the zone of inhibition is 29 millimeters or greater, this species is considered to be sensitive to penicillin G. So whenever we do this test, you have to look up the table for the NCCLS for which bacteria you plated and which antibiotic you're testing, and see the zone sizes to determine whether it's resistant or sensitive. And obviously between it could be intermediate. Any questions about any of that? All right, know the terms of this lab. You're not going to be physically performing any of these activities, but you will be seeing some videos, you will be doing a virtual lab, and you will be responsible for how to interpret the effectiveness of antibiotics using the Kirby-Bayer disk diffusion method. For procedure 1, we have a little video for preparing a spread plate, so watch that video, and then review the steps for using aseptic technique for preparing a spread plate or bacterial lawn of growth. And let me go ahead and show you how you do that. So we're going to pretend that this, hopefully you guys can see this, is my Petri dish. Can you guys see this? Let me stop the share and then I can see it. Yep, you can see it. Kind of, as long as I have it in front of my face. We're going to pretend that this is our cotton swab. We're going to pretend that, I don't know, here's something that, I guess I'll wash this. We're going to pretend this is our stock culture. You take the sterile cotton swab and you put it in the stock culture, get it in the liquid of the stock culture, and then get the worst part of the, oops, let's go up here. Get the worst part of the stock culture. I'll do it on the outside so you can see it better. Let's go here. Touch the cotton swab to the edge of the inside the cup. You can't see it inside though, so I'm doing it outside. To get the worst of the liquid off. You don't want to put like a drop of media on your agar plate. So you get the worst of the liquid off, and then you open up your plate. And as you know, you keep it partially covered and come in like that. I'm going to take the lid off just to show it better. And then you take your cotton swab and you streak it everywhere on the plate. I don't know if you can see that, but there you can see it better. Oops. And then you rotate the cotton swab a quarter of a turn. You rotate the plate a quarter of a turn. And I'm going to have a hard time doing this because I've got it at the wrong angle here. So you then use the cotton swab once again, going everywhere on the plate. And then you rotate the cotton swab a quarter of a turn. You rotate the plate a quarter of a turn. And then you take the cotton swab and you go everywhere on the plate. The point is to have the bacteria growing everywhere. So you get a lawn of bacteria. A lawn has your grass growing everywhere. Right? And then you take the cotton swab and you go around the edge of the plate. Because while you're streaking, sometimes you will miss the edge. Let's see if I can do that. Like right there, I didn't quite go all the way over, and then I went back. And so you take the cotton swab and go around the entire edge of the plate, trying to show it. There we go. Yep, I lost it now. It only shows when I have my face there, so that's the problem. And that way you put bacteria everywhere on the plate, and then it will grow a lawn of bacteria. I once had a student when I was teaching the microbiology class in the class, and she went doop de doop doop doop, doop de doop doop doop, doop de doop doop doop. And then she had these big, huge gaps of no cells on the plate. And she couldn't see the zone of inhibition because there are so many large gaps on the plate. You need the lawn to grow everywhere to get a good zone of inhibition. And I told her she had to either redo the experiment or use her lab partner's data because her data you could not use. All right, let me start sharing the screen again. Should be seeing my screen again. And you always swab the plate at least 3 times. Some people say 4 times, but you always swab the plate 3 times with the bacteria. You then let the bacteria sit on the plate for 5 minutes to absorb the liquid from the cotton swab. You label the plate appropriately. And where do we put the agar, the paper disc down? I'm not seeing that here. So this is just making a spread plate with the bacteria growing on it. We don't have the antibiotics put on it yet. Maybe that's the next thing. Label the plate with your initials, the date and the medium, the inoculum, what bacteria was, and the temperature is optional. Incubate the plate, agar side up. So the agar is on the bottom here. I don't know if you can see this or not, but you then put it in upside down. And that is one reason why you actually, after you put the paper disc containing the antibiotic on, you let it sit for a few minutes so that the paper becomes attached to the agar. And then when you put it upside down, it doesn't go down. Another thing you can do is take your loop or take some sterile forceps and just gently press the agar down onto the plate so that when you turn it upside down, the paper plate doesn't fall off. And then incubate the plate at 35 degrees C between 16 and 18 hours. Here we're doing in the lab for overnight because obviously you're students and we're not going to do it exactly 16 to 18 hours later. We'll do it more like 24 hours. So the bacteria should be growing everywhere. And then let's take a look at evaluation antibiotic effectiveness. View the following video clips to complete the virtual lab. Here is a movie, a little video on performing the Kirby-Bauer diffusion method, and then a little movie on interpretation of the results for the Kirby-Bauer diffusion method. And there is a virtual lab, which it might not work here. I should go to the worksheet here. And do the virtual lab. What you want to do is click start once you come here. And then this is showing you the Kirby-Bauer diffusion method for E. coli with these antibiotics. And what you do is you grab the ruler and you bring it up here and you try and move it to the end along the diameter, so right in the middle of the plate, and then you measure the diameter. You can only do it 1 time. Usually I tell students you should do the diameter 2 times, like once here and once there, but this ruler you can only move it this way, so you can't do it another way. So we can only do it once here, and that looks like about 17, 18 millimeters. The antibiotic is TE, which is, I believe, tetracycline. And so 17, 18 should be intermediate. If you get the correct color, it'll be green. If you get the incorrect color, I don't know if that'll work. You'll get a red X through it. CC, we have nothing. So less than 14. and it's green too. Any question about any of that? All right. You then click the menu button and restart, and you notice how it's a different bacteria. This is Pseudomonas aeruginosa, and there's the zone of inhibition. You'll notice there's only a few zones of inhibition. Let's go ahead and measure this one. CIP, that's about 43. Let's go down just a little bit. Oop, not lined up. About there, maybe a little more. So maybe 41, 42 for CIP. So definitely over 17 and it's green. And then hit the menu button again, restart, and it gives you Staphylococcus aureus. And you can see most of the bacteria are resistant because there's no zones of inhibition except for this one, which that's vancomycin, which means this is probably MRSA, Staphylococcus aureus, which is multi-drug resistant. And there's the thing there, you go there. It's not this one, that'll be wrong. All right, any questions about how to do the virtual lab? So green if it's correct, and red X if it's incorrect. You will need to do the virtual lab to answer some of the questions in the lab. Let me check on that just to make sure that's true. Let's get out of here. Let's see, where am I going now? I'm looking for, let's check the questions of the worksheet. If it doesn't have it, I'll have to upload another document. Oops, lost it. Yep, question 11. You need to do the virtual lab to answer question 11. All right, any question about the virtual lab? When you're done with that, then start answering the question. Question number 2, using the standards required for the Kirby biosusceptibility test, an E. coli culture is prepared using the spread plate technique. Antibiotic discs are placed on the surface of the agar and incubated overnight at 35 degrees Celsius. Below are the results along with the NCCLS zone standards used for interpretation. So here is ampicillin, cephaloporin, gentamicin, tetracycline. And these are the zone standards for E. coli and Staphylococcus aureus. We only have E. coli. As it's stated, it's E. coli. For reading the calipers, you do not measure from here to there because this 0 isn't here. What you do is you read from this 0 to that 0. So for ampicillin, I'll do the first one for you. That looks like just a hair less than 15 millimeters for E. coli. And that we see is intermediate in the table of the NCCLS standards. So fill in the answer. The size is 15. the interpretation is it's I for intermediate, and I've done the first one for you. So do the rest for SF, gentamicin, and tetracycline. Remember, you do not read from here to there, because that looks like 10. You read from 0 to 0. That's how you read calipers. Any question about that? All right, so fill in the table for number 2. And then for 3, list 5 variables that must be standardized when performing the antibiotic susceptibility test when using the Kirby-Bayer disk diffusion method. That was discussed in the lab module, and it's also in a table in the lab module. 4, the size of the zone of inhibition often varies for 2 different species of bacteria when challenged with the same antibiotic. What is a possible explanation for these differences? 5, what would happen if we didn't use aseptic technique to put the antibiotic disc on the plate? Mention what will happen to our test results. So what would happen, and then mention what happened to the test results. And then 6, what would happen if we increased or decreased the concentration of antibiotic in a disc? Be specific in your answer. And you must answer for both increased and decreased concentration of the antibiotic. 7, antibiotics can be bactericidal, they kill microbes, or they can be bacteriostatic, they inhibit microbial growth, but do not kill the bacteria. When observing a zone of inhibition around a disc, how would you determine whether the antibiotic causing the zone was bactericidal or bacteriostatic? This is a thinking question. Students often get it wrong the first time. So I'm warning you, you need to think about this one. Fortunately, most students do get it correct the second time. 8, when performing antibiotic sensitivity testing, it's important that the test conditions are kept very standardized. We have the same type of media, Mueller-Hinton, always the same agar depth, always the same age of culture. Why? Explain your answer. 9, are there other substances besides antibiotics we could evaluate using this method? And let me add there, name a substance. So don't just say yes, you need to name a substance that can be evaluated using the Kirby-Bayer method, besides antibiotics. 10, does the presence of the zone of inhibition necessarily mean the bacterium being tested is sensitive to the antibiotic? Explain your answer. And 11, the size of the zone of inhibition of chloramphenicol on E. coli in the virtual lab. Is the bacteria sensitive, intermediate, or resistant to that antibiotic? For chloramphenicol on P. aeruginosa, is the bacteria sensitive, intermediate, or resistant to that antibiotic? All right, any questions about the lab? If
I
not,
have a question. On the let's see, question 3, where it says list the 5 variables. I know that the table had more than that. So are we just using the first 5, or does it matter which 5?
doesn't matter which 5.
Okay,
Okay,
thank you.
all right. All right, if there aren't any further questions, if there are, go ahead and ask. I'm going to pause the recording, but I'm here until, about 8:30 or the last student logs out. Once the last student logs out, I will also log out. So if you have a question, please ask it. And for the student who wanted to have a Zoom meeting with me, we can have it after the lab or we can have it now. if you don't mind other students listening in. If you don't want students to listen in, we'll have to wait until all the students log out, but I can have it now. We can also schedule a time now if you don't want to do it now.
Can we schedule a time?
Sure.
Okay. What would work best for you?
Do you want to do it tonight or you want to do it some other time?
I can't tonight.
Okay. So when can you do it?
Preferably if we could, would tomorrow work for you?
No, tomorrow I'm not going to be in town.
Okay, so you let me know what's best for you and I can schedule around.
Well, like I said, usually after the lab is the best for me, and we can do it after Tuesday's lab if you like.
It's just hard for those days because it's already late. I need to put my kids to bed and deal with that after lab. So
How long is this discussion going to be?
one second. I don't know, just I don't it just depends on what is being said and
Okay,
how
let's
there's a solution.
just schedule it by ear and we'll try to get together sometime. I'll send you an email if you're available. We'll get together shortly after the email. If not, I'll send you another email.
Sounds good.
Okay, hold it. Who's talking now? Okay, Shawnee Buckner. All right. Let me write that down and well, I'll just send you an email right now. All right.
Have a good night.
All right, you too.